Hi, everyone, and welcome to our new Global Ambassador series, where we will learn more about the G20 and G7 Health and Development Partnership ambassadors and listen to their views on the most pressing global health issues, as well as how we should approach them. My name is Diya Nadeem. I am the G20 and G7 HCP Youth Ambassador, and I will be conducting the interview for today. The first round for the series is a quick introduction with each ambassador. I'm happy to introduce Mareike for today. Nice to have you here. Could you please start by introducing yourself?
Yes, hi dear, and it's really a pleasure to be here today, and I'm looking forward to having this conversation. So my name is Dr. Mareike Ostertag. I am the CEO and founder of Tembramo Advisors, which is a small consultancy that focuses on health policy globally. And prior to founding my own company, I used to work for pharmaceutical industry for over 20 years in various different roles. But for the last 8 years, I was mainly working in health policy for a large pharma company.
Amazing. So with your health background, in your opinion, what do you think are some of the major global health challenges today?
Well, I think health is such an integral part of everything that we do that health needs to stay on the agenda, and that is a key challenge in itself. So look at what is happening. We haven't really recovered from COVID, and yet the focus has shifted to wars and defense, to energy crisis, food scarcity, climate, of course, right? And so just to maintain health on the political agenda without politicizing it, which is a challenge in itself,
Yeah.
I think is really a key element that we all on this planet need to get right somehow, right? So I think maintaining health, ensuring sustainable funding for health, understanding that health is a contributor to the economy as well as a substantial budget item, so to speak. But also, and here I'm speaking in my role of as ambassador of women's health for the G20 Health and Development Partnership, we just need to make sure that 50% of the population are not, left behind in anything from basic research to access, just because they're female.
Yeah, exactly. And why do you think it's so vital that we tackle these challenges and how do you think we can do this?
Well, I think that it is vital. I mean, that was, I think, quite obvious from my previous answer that it is vital we get this right, because otherwise we cannot develop not just economically, but also for individual well-being in the years to come, right? For anyone on this planet. So how can we tackle this? I think one of the really important pieces that we as a partnership can look at is to really join the dots, right? We have to focus on specific elements. We cannot boil the ocean. But when we as a partnership work together across all the different organizations that are there, if we join the dots between the G7, the G20, but also the bigger geopolitical universe, and have, how should I say, sustainable recommendations that are implementable, I think step by step we can really make a significant impact, but it takes a mindset change for everyone.
Yeah. And how important do you think the convergence between G7 and G20 agendas are in addressing these challenges that you've mentioned?
I think it's hugely important. Because, we mentioned the geopolitics right in the beginning. I think the more tensions we have and the less convergence we have, the more challenging it will be, what is already a huge task,
Mhm.
to make meaningful progress. So I think the G7 and the G20 are uniquely positioned also in the constellation of the countries that belong to each of these groups respectively, to make significant progress if the agendas are aligned and if they're aligned within the groups. So I think it's hugely important.
Yeah. And finally, how do you think the G20 and G7 Health and Development Partnership can help towards prevention and or solutions to these challenges?
So I think we've tackled that a little bit already. The G20 and G7 Health and Development Partnership is a unique constellation of organizations from private sector, NGOs, all the way to the political arm that then we need for the implementation in the respective countries and regions. And with a very broad set of partners and stakeholders and within these partnerships, the stakeholder network is then even amplified, right? So I think the partnership, as I said, is uniquely placed. And if we take individual topics, as I said, the economy, financing, innovative financing models, specifics such as pandemic preparedness, AMR, and obviously, here I am, women's health, and try to ensure consistency across not just the yearly presidencies, but also following throughout several years so that we continue to be able to build on what we have achieved, in the previous year. Don't start from scratch every year. Ensure that there's good handovers between the presidencies. I think we have a very strong role to play. And I think we're already doing a very good job as the partnership to do that. But there's obviously always this little bit more that we can do. But that, I think, in a nutshell, is really the unique opportunity we have as the partnership.
Mm-hmm. Thank you. Thank you so much for your time, Mareike, and thank you for your insightful answers.
Thank you, Diya. It was a pleasure to talk to you. Thank you.
Thank you.